I'm Dr. Washington-Hyde at NYC Health and Hospitals, Kings County. I'm here today to talk to you about adolescent suicide prevention and the importance of this. Suicide is the second most leading cause of death among individuals 10 through 14. And it's the third leading cause of death among individuals 15 through 24. 1 out of 5 high school students has experienced thoughts of suicide. Even more importantly, children of color under the age of 13 are twice as likely to complete and die by suicide. Parents may ask, what are the warning signs of suicide attempt? One of the most important and prevalent warning signs of suicide attempt is verbalizing suicidal thoughts before the behavior. Also, profound feelings of hopelessness may be seen, along with mood changes such as sadness and irritability. Reckless behavior may ensue, and substance abuse is also commonly seen preceding suicide attempts. What are some of the risk factors that can predispose an adolescent to a suicide attempt? So these can include profound loneliness and feeling disconnected from social supports, family conflicts, bullying at school, non-suicidal self-injury, a suicidal contagion. This includes knowing people such as family or friends that have completed suicide, which puts an adolescent at higher risk for attempting suicide themselves. Interpersonal losses such as death, divorce, having to move to an entirely different location, and even health problems can predispose an adolescent to suicide attempt. Also included is sexual orientation confusion is a risk factor for adolescent suicide attempt. So what are the different ways to prevent these numbers and the crisis of adolescent suicide attempts? Well, in the hospital, particularly here at Kings County, we use the CSSRS, Columbia Suicide Severity Rating Scale, as a way to assess risk factors for the likelihood of attempting suicide. We also use safety plans. Any hospital or even outpatient facility can utilize safety plans to help decrease the risk of suicide attempt. These include identifying warning signs, internal coping strategies, people who can help during a crisis, people and/or social settings that provide distraction, and professionals and agencies to contact during a period of acute crisis. What can parents do to try and prevent some of these suicide attempts? Well, in order to decrease the possibility of impulsive suicide attempts, we recommend removal of things in the home such as firearms, sharps, pills, alcohol, and household poisons. Firearms are the most common method of death by suicide, while overdosing is the most common method of attempted suicide. Removal is preferable to locking up or hiding, but we understand this is not always possible or practical. One of the things you can also do at home is create a hope box. That way you can have that during a crisis. What is a hope box? A hope box is a box or a container that has items or mementos that elicit positive feelings that serve as reminders of reasons to live. These can include favorite things, favorite people, letters, gifts, a note card with written coping skills, or even a safety plan. Another way parents can decrease the risk factors of suicide attempts during an acute crisis is to increase parental monitoring, even if this means 24/7 adult contact with that adolescent. to prevent behaviors such as jumping in front of the train or into traffic. Different therapies can be very effective, or evidence-based strategies for prevention, such as multisystemic therapy, which is shown to be more effective than hospitalization at decreasing rates of adolescent suicide attempts. DBT is a well-established, empirically supported treatment for adolescents at risk for suicide. There's a number of different crisis center hotlines to contact during an acute suicidal crisis, and they're listed right here. And thank you for joining us today at King's Talk for Adolescent Suicide Prevention.